Okay, now it is started.
Yes, we are live.
Okay, working?
Yes.
Okay.
Okay, just a second. I have to close this then. Then I have to come on the. Got it. Yeah.
Okay, ma'am. So,
Yeah.
good evening, delegates and participants. Thank you for joining Shield Connect. And today we are back with our hit series, Icon with Dr. Ritu Santwani. And today, icon for the day is
निशांत बोलते बोलते सेम बोल गया.
ma'am herself is icon today for the speak on the topic stress and infertility. So before I start, let me give a quick introduction of Dr. Ritu Santwani, ma'am. So ma'am has done MBBS, MD, FICOG, FIEOG, MARCOG. Ma'am is obstetrician and gynecologist, IVF infertility specialist in tested baby, NUHS from Singapore. Ma'am is co-founder of MAAM and board member of WSCG, and ma'am is founder and CEO of her new clinic, 360-degree healthcare studio. Do visit, it is very beautiful. The clinic.
Thank you, Nishant.
So, ma'am, I hand over the session to you, ma'am.
Yes. So, hello everyone. A warm welcome to my dear friends who have joined all across the geography. Yeah, too good to see my batchmate Deepthi has also joined. Dr. Bina Nayak, Dr. Samuel has joined from the Africa. Yeah, from Egypt also Dr. Mona has joined. Hi, Dr. Poonam. Dr. Poonam, I missed you in the Varanasi. Too good to see Ritu Khanna madam has also joined. Yeah, Reja, Dr. Archana, Dr. Vemprala. Yeah, thank you for joining. So, yeah, hi, Dr. Swati. So today, and Dr. Ali, hello to you also. I think I have not missed anyone's name. Huh? So, and Dr. Mona, hello too. So today we are going to discuss a very important topic regarding the stress in infertility. Being a ART consultant or being an obstetrician and gynecologist, all of us are getting lot of patients of infertility who are too much of stress. So whether the stress causing the infertility or whether the infertility is causing the stress, this circle is vice versa is going on. So when Prachi and Nishant approached me from the Shield that, madam, you have to speak on this. So I told, yes, this is a very needed topic for the day, because all of us getting so many patients of this. So let me start my presentation. Yeah, hi, Dr. Amal. Amal has joined from the Egypt. Yeah, warm welcome. So I am sharing my screen. Is it visible? No, na?
Yes, ma'am. The screen is visible.
नहीं, मुझे नहीं दिख रही है. ऐसा कैसे?
Desktop is visible.
Desktop is visible, na? So I will stop. No, wait. I will share screen again. ये चैट का विंडो कैसे छोटा करते हैं? I think chat वाला is highlighting on my.
There is some down arrow, ma'am. You can click on that.
अच्छा. Okay. अच्छा, okay. Now I am sharing the screen. No, it's not visible. Why it's not visible to me? It's not visible to me.
It's not visible to us also, ma'am.
Achha, okay.
Only
what happened?
We can see the desktop.
We can see the desktop only. तो क्या करूँ? Quit करके वापस join करूँ? अभी तो मैंने
Ma'am, first open the slides and then
I
sharing.
I already opened the slide and kept on the desktop. Na? That's why I've checked. Na? Means every. Just a second. I am able to see only Nishant. So it is. No. So what I do, I think slide is already opened here.
Saiti, ma'am can rejoin, so it will be.
Yes, ma'am.
Yes,
Huh?
ma'am. Yes,
I think that will be much better, no?
Yes,
ma'am.
ma'am.
Which I'll stop sharing and let me try once. Huh?
Yes, ma'am.
Wow, today my patients are also joining. Hi, Priyanka. Huh.
That's so good.
Because topic is like that. Now everybody's so much stressed these days. Now I think it's visible.
Yes, yes,
Yes,
ma'am.
ma'am. Yes, ma'am.
Yeah. Clear, Nishant?
Perfect, ma'am.
Ma'am, perfect.
Okay. Thank you. Thank you. So a very warm welcome to everyone. Nishant has already introduced me. So thank you, Nishant. So friends, as all of you are aware, whether my national or international presentation, I always start with Mata Durga Stuti. We all have gone through 3 bad phases of Corona. Again, the Corona is now coming on the peak. So please be very careful. So this presentation will start with these 2 lines. Ya Devi Sarvabhuteshu Chikitsa Rupen Sansita Namastasyai 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 Namo Namah. So friends, as we all know that knowledge is power. So, and knowledge always increases by sharing. So today, what in our practice we are getting that how much the infertile couples are stressed, and how can we reduce their stress by the medication, by the counseling. So today I'm going to present some, what are the studies are saying about that. And later on, I want that everyone should give the opinion that how they are treating their patients for this stress portion. So infertility is the new epidemic of young India. India faces a high burden of infertility with 22 to 33 million couples in the reproductive age suffering from lifetime infertility issue. So we daily getting more and more patients who are coming to with the stress problem in the infertility. So 1 in every 4 couple in the reproductive age in India struggle with infertility. More and more young Indians are finding it hard to conceive. At least 10 to 15% of the married couples are experiencing the fertility issues. So what the incidence suggests, incidence is showing that 40 to 50% of the cases are attributed to the male, and rest for the both the male and female are considered to be the equally. And these days we all agree on this. The male infertility in India is on rise with every passing year. So we all know the lifestyle plays a very important role for the infertility. So when the couples are coming to us for TTC trying to conceive, we tell the couple to avoid the stress as much as they can, whether at home or at work. क्योंकि बहुत सारे ऐसे पेशेंट्स आते हैं ओपीडी में जो बहुत ही ज्यादा स्ट्रेस्ड हैं. दे टेक एज अ लाइक दैट एज अ प्रोजेक्ट बेबी. उनको ऐसा लगता है यस दिस ईयर वी हैव प्लान्ड दिस, तो इस साल के एंड तक डिलीवरी हो जाना चाहिए. इफ दे आर नॉट एबल टू कंसीव, so the frustration goes on increasing and they are getting more and more depressed. So sometimes a peaceful and relaxed intercourse is all it takes to get pregnant. But given our lifestyle and the heightened levels of stress that it brings forth, even the simple process seems to be eluding the most of the couples, as I already told in the earlier, whether the stress causing the infertility or whether the infertility is giving the stress. So feeling of anxiety and stress does have some long-term consequences. Infertility can be triggered by stress, depression, and anxiety. Stress and anxiety can be triggers for hormonal imbalances and decline in fertility. So usually the patients when are coming for the ART treatment, IUI or IVF, they already have an anxiety about whether the treatment will work. Also can also undermine a person's mental health. So what do we understand by stress? Any type of change that causes a physical, emotional, or psychological strain. Sometimes they are having a lot of pressure from the family कि अभी आपको प्रेगनेंसी होना चाहिए, आपके in the social circle everybody who is get married along with them, or post 1 or 2 years after them is having a kid, still you have not conceived. So these kind of so many strains they are having. Stress is your body's response to anything that requires the attention or action. The relationship between the stress and infertility has been debated for years. Women with infertility report elevated levels of anxiety and depression. So it is clear that the infertility causes stress. What is less clear, however, is whether or not stress causes infertility. So this, while making the PPT, I found this lovely gift, so I focused on this. So they are saying that they have to handle the office stress, work pressure stress, home stress, and besides that, they are not able to conceive also. So there are a lot of stress. So now, what is stress? Stress is a natural reaction of the body and of the mind to everyday tension and pressure. It is not a disease. Stressors can be internal, worry about a future event, or external, poor working conditions, and induce variable reactions in people. Anxiety is the response to the stress. Stress can be short-term, but anxiety can remain for long-term. So here we can see the stress is caused by an existing stress-causing factor or stressor, while anxiety is a stress that continues after the stressor is gone. So these are the beautiful gifts what I find out while making the PPTs. So as I told earlier, the type of stressors, psychological stressors, fear, depression, anger, physiological injury, pain, infection, or the environmental stressors, occupational, diet, and the social stigma. I think in our India, the social stigma is playing a very, very important role. The couples are getting a lot of pressure from the family and friends. Here I will say 2-3 lines in Hindi. Sorry friends who have joined all across the geography, because हमारे इंडिया में क्या होता है कि हम किसी भी फंक्शन में जा रहे हैं या कहीं भी जा रहे हैं तो लोग सबसे पहले ऐसे ही पूछते हैं आपके बच्चे कैसे हैं, आपके कितने बच्चे हैं. No one will ask that how your job is going on and how you are doing. The conversation will start with like that only. So that gives them more depression to the couples who are planning for the pregnancy or trying for the pregnancy. So my talk will include some references what are come recently. So this, while making PPT, this is from the PubMed, very recent, you can see from 2018 only, the relationship between the stress and infertility. What I shown the earlier is quoted by the Christine Brunet. So now coming to the stress, whether it is an acute stress or chronic stress. So acute stress, as we know, is a short-term coping mechanism, works essential in day-to-day life. While the chronic stress is the result of the stressors that continue for a long period of time. This type of stress feels never ending. There is a failure of coping mechanism. It leads to many complications. So either as the increased BP, increased heart rate, increased sweating, chest pain, constipation, diarrhea. These are the some presentations. Or the emotional, yes, irritability, loneliness, anxiety, depression, worrying. These are the some other manifestations. While in the behavior, some may tell that ma'am, due to anxiety and depression or due to really for the stress, I am addicted to smoking or alcohol, biting of nails, disturbed sleep, more eating and eating less. This is both of these patients, we are getting a lot of these patients. Some are having a binge eating, some are having a totally anorexia. So now, as we all know, the stress, how it can lead to male and female infertility. We know the sexual dysfunction, hormonal imbalance, sperm counts, motility, and morphology altered, disturbed menstrual cycles. Stress may also affect implantation and also negatively affects the ART outcomes. So here, as we know, we all aware of also that stress of any kind, whether the occupational, mental, or physical. So most of the patients, some patients, only last week I have seen the patient, she is athlete by profession, and she told me only कि मैम मुझे तो बार बार periods irregular हो जाते हैं, and sometimes I have suffered from this amenorrhea also. So that is the due to excessive stress, the runner's amenorrhea is the terminology is used. And in some patients, due to this stress, the hyperprolactinemia is there. So, and again, the hyperprolactinemia will causes the ovulation disturbance. Similarly, ovulation disturbance and lack of sexual desire. Similarly, in the males, we have seen the patients due to stress having a failure of erection or premature ejaculation, and in some the retrograde ejaculation also reported due to stress in some studies. So now to understand the stress, let us study the nervous system. Nervous system is the system of communication and well-being. Keep us in touch with our environment, both external and internal. Center of all mental activity, including thought, learning, emotions, memory, and balance. So, as we know, the functions of the nervous system: sensations, perception, thoughts and emotions, learning and memory, movement, balance and coordination, sleep, healing and rehabilitation, stress and body's response to stress, breathing and heartbeat, body temperature, hunger, thirst, and digestion. So the cells in the nervous system, as we know about the neuron, the actual nerve cell is a neuron. It is the conducting cell that transmits the impulses and the structural unit of the nervous system. The other type of cell is the neuroglia or the glial cells, the supportive in function and a form of the connective tissue for the nervous system. So this neuron or nerve cell are classified as afferent, efferent, and interneurons. We all know of the basic of the nervous system. Afferent is the neurons which carry impulses to the CNS, while the efferent which transmit the impulses from CNS to periphery, while the interneurons which are located entirely within the CNS as a connecting link between the afferent and efferent neurons. So we are also aware of the motor neurons, sensory neuron, and interneurons. The motor neurons, as we can see, which transfer the impulses from CNS to sensory organs, while the sensory neurons, which brings the sensory impulses from sensory organs to CNS, while the interneurons, which enables the communication between the motor and sensory neurons by creating the neural circuits. So in the central nervous system, we are aware of is the brain and spinal cord, and the spinal cord which travels from back of the brain down to the center of the spine. So as we are aware, because this all is mediated by the central nervous system, which controls thoughts, movements, emotions, breathing, heart rate, hormones, body temperature, and much more. So while the peripheral nervous system, because this is the basic physiology, I am taking in some slides and later on we come on the treatment. So the peripheral nervous system, which consists of the nerves branching out from the brain and spinal cord. The peripheral nervous system is having somatic and autonomic nervous system. Somatic nervous system in the nerves goes to the skin and the muscles and is involved in conscious activities, while autonomic nervous system, in which the nerves connected to internal organs and control unconscious activities. So friends, here it is clear the somatic is covering the conscious, while the autonomic nervous system is covering the unconscious activities. How do neurons communicate with each other? So we know, friends, the communication is known as a neurotransmission and the signals or impulses. And the neurotransmitters are the body chemical messengers that transmit messages between the neurons or from neurons to muscles. Communication between the two neurons happen in the synaptic cleft. We can see here the synaptic cleft communication where both neurons happen. While the synapse is the site of the transmission of the electric nerve impulses between the two nerve cells or between a neuron and a gland or muscle. The arrival of a nerve impulse at the presynaptic terminals causes the vesicles to fuse with the membrane and the release of a chemical substance called a neurotransmitter. A neurotransmitter transmits the nerve impulse to the postsynaptic fiber. So we know the neurotransmitter influences either the excitatory, inhibitory, or modulatory way. So excitatory transmitter will generation of an electrical signal called an action potential, and an inhibitory transmitter prevents it, while a neurotransmitter is excitatory or inhibitory, depends on the receptor it's bind to. Neuromodulator regulates the populations of neurons while also operating over a slower time course than the excitatory and inhibitory transmitters. So friends, we know because what we are going to give for the treatment, that all depends about the basic physiology. So the inhibitory neurotransmitters, as we know, the GABA, serotonin, and endorphins, while the excitatory is the adrenaline, glutamate, and acetylcholine, and dopamine is a neuromodulator. We all aware of that. So many hormones have a role in stress, and have to understand the endocrine system also. So amongst the endocrine system controls, we know, and coordinate the body metabolism, energy level, reproduction, growth, development, and response to injury, stress, and mood. While the hypothalamus is a part of the brain that has a vital role in controlling many bodily functions, including the release of hormones from the pituitary gland. Here we can see. So we know the hormones from the hypothalamus which are releasing is the thyrotropin, corticotropin, gonadotropin releasing hormone, growth releasing hormone, growth hormone releasing inhibiting hormone, prolactin releasing factor, prolactin inhibiting hormone. All of these released into the blood in the capillaries and travel immediately to the anterior pituitary. So pituitary gland is considered to be a master gland, a pea-sized body attached to a base of the brain that is important in controlling the growth and development and the functioning of the other endocrine glands. So here we can see from the anterior pituitary hormones, the ACTH, FSH, LH, all the hormones are mentioned, the TSH, prolactin, endorphins, then posterior pituitary oxytocin and ADH, which acts on uterine muscles, mammary glands, and kidney tubules, as we are aware. Now the stress pathways. Just a second. Am I not audible? Nishan?
Ma'am,
You are audible, ma'am.
I have been getting some messages on this WhatsApp that my voice is not coming.
No, ma'am, it is very clear.
Okay. Yeah, thank you. So stress pathways. So we all are aware the three stress pathways, either the hormonal pathway, neuronal pathway, and brain waves. So we know stress disturbs the hormonal and neuronal and brain waves. So the body's response to stress, the situation is judged and decided to be stressful. Then hypothalamus is alerted. If the hypothalamus decides the stress is acute, then it activates the sympathetomedullary pathway from the hypothalamus to adrenal gland and medulla. And if the hypothalamus decides the stress is chronic, it activates the hypothalamic pituitary axis. So we all know about the adrenal gland. So this sympathetomedullary pathway, in which the hypothalamus activates the adrenal medulla, and adrenal medulla which secretes adrenaline and which prepares the body to get ready for the fight or flight response, we all are aware. And this adrenaline, in the prolonged elevation of the adrenaline, causes the anxiety, elevated BP, heart rate, palpitations, and low insulin and blood glucose levels. While the hypothalamic pituitary axis, as we told about for the chronic response, in this it releases the ACTH, which in turn acts on the adrenal cortex, which is stimulated to release the hormones such as corticosteroid plus glucose, which helps to increase the body's energy level and cortisol. Hypothalamus pituitary adrenal axis. So here we can see the hypothalamus, pituitary gland, adrenal gland. It causes the adrenal cortex, causing the cortisol release, while the medulla is releasing the adrenaline. So again, the stress disturbs this hormonal pathway. Here we can see the corticotropin releasing hormone, which again from the adrenal cortex increases the cortisol, and from the medulla the adrenaline. So treating for this, the basic pathophysiology, we must again, so this is a kind of revision of the basic revision for the CNS and the endocrine pathways. So we know now how this cortisol is increasing, is releasing more, and cortisol is considered to be basically the stress hormone. The normal levels are 6 to 18 nanogram per 100 ml of blood. So this cortisol level, high cortisol level, causes the increased blood sugar, weight gain, fatigue, increased anxiety, joint pain and muscle aches, low libido and mood swings, high BP, higher rate of infection, osteoporosis, and changes in the skin. Because some age spots, wrinkles, acne, psoriasis is also contributed to the high cortisol levels. Now, effects of increased adrenaline and cortisol, disturbance of hormonal pathway, increased cortisol and adrenaline secretion inhibits the GnRH and gonadotropins, decrease estrogen and testosterone, decrease oogenesis and spermatogenesis, decrease progesterone, impaired endometrial receptivity, decreased libido, and causes the infertility. So friends, here we have seen that how stress is coming in the each and every pathway of the infertility treatment. So because here we can see with the where the estrogen and testosterone decreasing to low libido, less sexual desire, then not good quality of eggs are coming, or the premature ejaculation, retrograde ejaculation, or erectile dysfunction. These are the some. Then again the impaired endometrial receptivity. So all are coming correlated with each other. So now this, as we have just discussed about this hypothalamus, the FSH, LH, how the ovarian development, oocyte maturation, again from the testes. So effects of high cortisol level in female, again we can see this is very important. So inhibits GnRH, reduces LH, FSH, reduces estrogen, impairs follicular development, affects oocyte quality, and affects implantation. So on each and every step of the infertility treatment is coming. Now the studies have also shown the relationship of the cortisol and progesterone. As we all are aware that after the ovulation, the corpus luteum releases the progesterone. Progesterone maintains the uterine lining. And as we know, if the egg is not fertilized, progesterone drops and triggers the menstruation. Studies have shown clearly, here we can see this stress causes the more cortisol release, which causes a low progesterone. The progesterone, which is having a calming, anti-inflammatory, and sleep promoting effect. So now coming to the males, in the males also, if it inhibits the GnRH, it inhibits the GnRH, reduces the LH, FSH, reduces testosterone, affects spermatogenesis, reduces the sperm count. Now coming to this neuronal pathway. So the studies have come for this glutamate and GABA. For the glutamate, it is considered to be the excitatory neurotransmitter, which increases the brain function and physical activity, while the GABA inhibitory neurotransmitter relaxes the brain function and physical activity, coping mechanism for the stress. So impact of stress on in the neuronal pathways, it increases the glutamate activity, decreases the GABA activity, failure of cope with mechanism, impaired spermatogenesis and oogenesis. So hypothalamic pituitary-adrenal and hypothalamic pituitary-gonadal axis are regulated by the GABA signaling. In stress, there is an inhibition or decrease in GABA, causing the increased level of corticotropin releasing hormone. Stress alters the activity of GnRH neurons and disrupts the reproductive events. So this all we have just discussed, that how the disturbance in neuronal pathway reduce GABA activity and increase corticotropin releasing hormone. This we have just discussed, that how it hampers the oogenesis and spermatogenesis, decrease libido. Now coming to the brain waves. So brain waves, as we are aware, are different types of electromagnetic waves which can be measured by EEG. So again, the studies have shown the brain waves can be measured on the surface of the head. The predominant frequency of the electrical impulses correlates with the different types of mental states and activities. Brain waves are classified into 4 categories, each with an associated mental state, as shown in the chart below. Here we can see alpha wave 8 to 13 hertz, awake and relaxed, while 14 hertz is awake and excited with the beta waves. So sleep disturbance and brain waves, stress converts relaxed alpha waves to high beta waves. So here we can see. So that's why for the once we are treating the infertility, we always tell the patient for the proper sleep also. So earlier we are using this melatonin. Now this drug has come, which is showing a very, very good results. So stress pathways in infertility, reduction in alpha waves, insomnia, stress, infertility. So again, the vice versa, the stress causes infertility, infertility treatment causes the stress. So friends, this study has come that impact of stress on oocyte quality and reproductive outcome. Stress induced cortisol induces the granulosa cell apoptosis and affects the estradiol biosynthesis in the ovary. So reduced level of estradiol in the ovary impairs the growth and development of follicles and deteriorates the oocyte quality by inducing apoptosis. So the studies have been supported by the so many journals. Similarly, for the studies have shown from this this study from the effect of psychological stress on fertility hormones and seminal quality in the male partner of the infertile couples. So the studies have shown that psychological stress primarily lowers the serum total testosterone level and thereby affects the seminal quality by decreasing the sperm count, sperm motility, and count of morphologically normal spermatozoa. Stress management is warranted for the male partners of the infertile couples. Similarly, here I mentioned as the IVF outcome, but we can take in the total ART outcome. So poor response to ART technique, success rate is 30 to 40%. More treatment cycles are needed, higher discontinuation rate. So the study has been presented by the Gulzar and premised the effect of psychological distress on IVF outcomes, reality or expectations. So here the studies have shown, yes, the need of the specific psychological interventions for all infertility women to improve the IVF success rates. This study has been recently published in June 2020. So it is stressful when we don't know why you are having trouble. So patients are struggling to conceive, reports feeling of the depression, stress, anxiety. So the medications used to treat infertility include clomiphene, letrozole, gonadotropins are associated. Again, while giving the treatment associated with anxiety, depression, and irritability, patients with one treatment failure had significantly higher levels of stress and anxiety, while the patients with 2 failures experienced more depression. So more depressed the infertile woman is, more likely she is to drop out after only 1 cycle, because this is very, very common. When in the 1 cycle or in the 1 OPD, the patient see that so many patients are coming for the infertility treatment. And by the next month, if their cycle is not successful and other patients are getting good results or getting pregnant, that gives more depression to the patients. Some of them drop out after 1 or 2 cycles, even though we explain them clearly. Whenever we are proceeding for ART cycles, so minimum 3 cycles we are needing for the IUI. Despite a good prognosis and having the finances available to pay for treatment, discontinuation is most often due to psychological reasons. Interventions including anti-stress treatment for women have the potential to decrease anxiety and will lead to significantly higher pregnancy rates. So again, this study has been come in the 2021 only, experimental and therapeutical medicine, the complex relationship between the infertility and psychological distress. So now how to manage this stress? So we know the yoga, meditation, holidaying, deep breathing, adequate sleep, and healthy foods. This is also very, very important. Change of the lifestyle is very, very important. So among the medication is what are given is diazepam, alprazolam, olorazepam, clonazepam, or acetalopram. But we are not giving this because once the patient is coming to us for the pregnancy planning, we can't give these medications. So I'm skipping this slide because this we are not using. So among this GABA receptors, this omega-1 and omega-2, the omega-1 GABA receptor causes the sedation while the omega-2 modulates the stress and anxiety. So this benzodiazepine has been reported to bind both the receptors, but it causes the sedation. So the limitation is it has no action on the hormonal pathway, no action on the brain waves. So it causes the sedation, withdrawal symptoms like hangover, addiction, and tolerance. So ideal solution is which acts on the 3 pathways as we have just discussed regarding the hormonal, neuronal, and brain waves, and no sedation, no withdrawal symptoms, and no addiction, and no side effects. So as we all are aware that the babies after the breastfeeding, after the breastfeeding get a proper sleep. So why the babies are relaxed and sleep after the mother's milk? So the casein from mother's milk, we know that the active component in that is alpha-casozepine, which has a relaxing effect. So this casein is by the alpha-casozepine, is a decapeptide. So this alpha-casozepine is not formed in adults. So casein from milk, the pepsin, active, altered milk protein, amino acids, and no relaxing effect. So here we have seen alpha-casozepine is not formed in adults. So this casein is converted via pepsin and trypsin to amino acids. So this alpha-casozepine is a peptide which is present in the hydrolysate. It has anxiolytic properties. It displays an affinity to the GABA receptor, fairly similar structure to benzodiazepine. This is the it is available with the product Lactium because I treat some of the other countries' patients also. So because of that, we are using so many preparations of this lacto serum for the as an anxiolytic. So now they have brought this in India, so this is very good. So this Lactium, to evaluate the anti-stress effect of the Lactium on the plasma cortisol in the human healthy volunteer facing the successive stress situations. So the different regimes has been explained. This is the study which is showing this this Lactium 200 mg BD and second day 200 mg in the morning. But usually the 1 capsule per day is good enough. Lactium on plasma cortisol, it has an anti-stress profile by preventing increase in the plasma cortisol level. So the studies have shown it's a self-evaluation questionnaire for measuring the anxiety in the adults. The good results has come with this on both the partners, male and female. This is having additionally, along with that, is L-theanine, which is the active ingredient of the green tea, which helps to relieve the stress by inducing a relaxing effect without drowsiness. L-theanine is an amino acid which is known to block the binding of the L-glutamic acid to glutamate receptors in the brain, which L-theanine increases the dopamine and serotonin production, we all know, for the happy hormones in the brain, and induces a relaxation through the enhancement of the alpha wave activity in the brain. Again, the studies has been supported by so many studies. Intake of 200 mg of L-theanine at bedtime improves the sleep quality by anxiolysis rather than sedation. So no such side effects has been reported in the studies. So the studies have shown by this combination, the alpha-casozepine reduction of stress regulates the GnRH percentile and normalizes the LH-FSH ratio. So normal spermatogenesis and improvement of the oocyte quality has been reported. So yeah, with no sedation with this drug. So a lot of studies in the support of this L-theanine also. It increases the activity of the alpha frequency band, which indicates that it relaxes the mind without inducing drowsiness. So for the drug, the Nishant is here. Nishant will tell us something more about that. So till now, some patients I'm using, so it is giving a good results. So it is acting on all the 3 stress pathways: hormonal, neuronal, and brain waves. So this already we have discussed. It is giving good quality sleep and improves the fertility outcome. So again, this is one study which has come very recently on April 2021, linking of stress and infertility more than a chicken and egg concept. So again, the lot of studies have come that the stress plays a very, very important role in the infertility treatment. So and the conclusion that we know the stress can make the conception more difficult for both. So it has been demonstrated that time and again the stress reduction techniques which are employed on a regular basis can improve the conception rates. So stress reduction is a non-invasive, less expensive, and ethically acceptable way of improving the fertility. The available evidences indicate the fertility treatment protocol should include the stress management and stress reduction as factors of major importance. So the relaxation technique which can reduce the stress score in the infertile woman as a complementary and alternative medicine. So we have to think for some treatment for the stress reduction also. Of course, the proper counseling is must. And so with this, I am ending the talk for today. Once the patient are coming to us with the great stress when they're infertile, but by the treatment, once they are conceiving, see how happy they are. So thank you to all of you for the patient hearing.
Thank you so much, ma'am.
So if there are any questions, I hope with my this discussion, some knowledge I have shared with all of you. So now I'm stopping the sharing. If any questions, me and Nishant both are here. Yeah.
So, ma'am, can I share a video of our product?
Yes.
If you give us permission.
Yes, you can share. Yeah. Hello, Geeta ma'am. Geeta Khanna madam has joined from the Lucknow. Yeah. Thank you, madam, for joining. Yeah. Hi, Dr. Rita.
Hello. Hi, Dr. Rita.
Ma'am. Hi, ma'am. Thank you for joining. Geeta ma'am, thank you for joining. Hi, Dr. Rita. How are you?
Yeah, I'm good, Dr. Ritu, and it was such a good, nice topic you have covered so nicely. Stress is very, very important factor, day by day we are facing so many patients like this, Counseling is very important and all points you have covered very nice. And I always try to, I don't want to miss your lectures. Thank you so much.
The best part is it is very good in the very right time. The time is very good. You really have finished your OPD and everything.
Thank you,
After
Geeta
finishing
madam.
everything.
Thank you so much, madam, for joining.
Yeah. Chalo.
Thank you, madam. Thank you once again for your blessings.
Okay.
Okay.
God bless you always.
Thank you, madam. Thank you.
Ma'am, shall I share?
Yes, you can share. You can share.
Thank you, ma'am.
Yeah.
Can we hear the music?
No,
Is it audible?
no, music is not coming.
So while sharing, click on share sound. Stop share and then
Stress
while
and
sharing,
anxiety caused by many day-to-day factors lead to infertility, both in men and women. Chronic stress and anxiety have negative impact on 3 pathways.
In hormonal pathway, stress leads to the increased production of cortisol and adrenaline, leading to reduced insulin secretion and increased glucagon production. This triggers glycogenolysis and aggravates hyperglycemia. In men, high cortisol and adrenaline induces Leydig cell apoptosis, decreases testosterone level, and affects spermatogenesis and leads to loss of libido.
In women, it leads to irregular menstrual cycle, induction of granulosa cell apoptosis, affecting estradiol production and oocyte quality, decreasing libido.
Ultimately, the fertility outcome is affected.
In neuronal pathway, there is reduced GABA activity and increased glutamate activity. This leads to failure of stress coping mechanism. Reduced GABA activity leads to inhibition of GnRH and impacts fertility outcome.
In the brain, stress induces the high beta waves, causing anxiety.
High stress impacts different stages like IVF preparation, oocyte retrieval, embryo transfer, and pregnancy test, leading to reduced IVF success rate. Doctor, in essence, an ideal stress solution should work effectively in all the 3 pathways, be better and safer than benzodiazepines.
Have you ever wondered why after breastfeeding infants feel relaxed, calm, and sleep? It is not because of satiety. It is in fact on account of alpha-casozepine, Lactium, God's natural gift to infants, the natural stress solution. Alpha-casozepine is the original research of Ingredia, France, in collaboration with University of Nancy. In infants with partially developed digestive system, casein is converted to alpha-casozepine by trypsin. Alpha-casozepine calms the mind and makes the infant sleep.
Introducing God's gift to couple. Aura Spa, the oral spa, a calm way to conceive.
Each capsule of Aura Spa contains alpha-casozepine as Lactium 150 mg and L-theanine 100 mg. Aura Spa, the ideal and natural stress solution, acts on all 3 stress pathways: hormonal, neuronal, and brain waves.
In hormonal pathway, Aura Spa reduces stress-induced cortisol level in 3 hours. Hence, the GnRH is activated. In female, it prevents granulosa cell apoptosis, normalizes estradiol production, and improves oocyte quality. In male, it prevents Leydig cell apoptosis, normalizes testosterone level, and improves spermatogenesis. Thus, Aura Spa improves the fertility outcome.
In neuronal pathway, it increases coping mechanism and GABA, while decreasing glutamate activity. Stress levels are significantly reduced and sleep quality improved.
In the brain, L-theanine produces alpha waves and relieves stress and anxiety in 40 minutes. Aura Spa is approved with US FDA GRAS, Korea Food and Drug Administration, AFSSA. Dose: 1 capsule once a day for both the partners.
Aura Spa, God's gift to infants, is now available for couple. Calm to conceive and improve fertility outcome.
Thank you so much, ma'am, for giving your time.
Welcome. Nishant, I have received 2-3 questions on my personal inbox. So there is one question. Doctor is asking for how much duration we have to give. So friends, we can give minimum up to 3 months or max up to 6 months. So this is having no side effects, so you can use, so no problem. Another thing, Nishant, this question you can answer regarding the price.
Price, right now it's 320 rupees, and it contains in one box there are 3 strips, and each strip contains 10 capsules.
So this is 320 for the
all over the box.
Means 320 rupees for a month.
Yes.
One capsule a day means
one capsule for 32 rupees.
One capsule 32 rupees, so that means 320 for the 10.
Yes.
320 for 10. Okay. So with this, we will wind up for today. Dear friends, thank you once again for joining. Good to see Asha Rati madam. Thank you for joining. Yeah, Dr. Archana. Yeah, hi.
It was very nice.
Thank you, madam. Thank you for joining.
Yeah, it was very nice. And it's really a revision of all CNS system. My favorite.
Yeah, thank you, madam. How are you, ma'am?
Yeah, fine. I'm fine.
Thank you, ma'am.
Nice.
Thank you for joining, madam.
Please continue like this. We will be very
Thank you, ma'am. Thank you.
We cannot open the books, na? We cannot open the books, but we can entertain and we can increase our knowledge with this.
Yeah, thank you, madam. Thank you for joining.
You are looking very smart. Okay.
Thank you, ma'am. Thank you. Thank you, Dr. Irina. Dr. Irina, you are from which country? Thank you for joining. Thank you, Dr. Aniket.
I'm from Saudi Arabia.
Saudi Arabia. Thank you for joining, Dr. Irina.
So much, ma'am.
Thank you very much.
Thank you, Dr. Francisco. Thank you, Dr. Idris. So many friends have joined. Thank you so much. Thank you, Dr. Aniket. Friends, before I wind off, let me tell you the coming. Please do stay tuned every Thursday at 8:30 p.m. with us. Next Thursday, we are going to discuss regarding the breast cancer. After that, the atypical presentation of fibroids, how to deal with that, what are the points we have to remember while operating, then what is new, the sclerotherapy has come for the treatment of endometriosis. So I am posting the flyers tonight only, so please stay tuned with us for the many more interesting sessions. Till then, bye-bye. Good night.
You are from Shield only?
Ma'am.
No, ma'am. I am from Sheila. I'm